How has the problem of sodium valproate in pregnancy been tackled?
So I just briefly wanted to go through the PREVENT programme just because wanted to make sure that healthcare professionals and patients and carers are fully informed about what it actually involves. So the PREVENT programme, as I said, it outlines some very, very strict criteria that need to be met. First of all, there needs to be, we need to make sure that valproate is only used where there's no other alternatives to treatment. So where other treatment has been ineffective or if there's side effects from other medication. If that criteria has been met, then the healthcare professional needs to make sure that sufficient measures are put in place before prescribing valproate and throughout treatment. This includes doing a pregnancy test to confirm it's negative before initiating treatment. And then once that's been met, to actually go through quite a lengthy risk acknowledgement form with the patient. And the patient needs to be present. The patient actually needs to sign to say that they have been informed of the risks and understand the need to avoid pregnancy whilst they're on treatment. The healthcare professional must provide information in the form of a PREVENT patient guide as well, so that the patient knows exactly what is required of them. And that includes also taking highly effective contraception throughout treatment. In addition to this, the healthcare professional must also review the patient at least annually to make sure nothing's changed, and at that time repeat the risk acknowledgement form to make sure all the checks are done again, just like I've outlined above.
Seems very thorough. Have any other measures been recommended?
In addition to this, other measures have been taken nationally. So you may have heard of the Cumberlege report, First Do No Harm. That was an independent medicines and medical device safety review. And amongst other recommendations, there was a requirement to establish a valproate safety implementation group. Now, this group works with patients to reduce harm and improve the safer use of valproate. So that's really, really important. Additionally, manufacturers have added a visual kind of warning on the outer packaging outlining the risks in pregnancy. And when the pregnancy prevention programme came into place, there was guidance from the Royal College of Psychiatrists, like you mentioned, but also MHRA and chief pharmaceutical officers wrote to pharmacists explaining to them that they need to issue a patient information leaflet each time they issue a prescription of valproate. Sometimes that worked well, unfortunately, other times it didn't. And now there's proposals being put in place to make sure that valproate is actually dispensed in the original manufacturer's packaging and not in white cartons, so that that warning that's on there is actually provided each time a patient is issued a prescription. So there's lots and lots of work being done. There's also registers to make sure that we can identify those women and girls who are prescribed valproate. And I guess there's lots of very good practice. It's just about having that joined up approach.
You mentioned there the Cumberlege report. What did this report find?
So they acknowledged that there were, a lot of people who have had valproate during pregnancy and have been exposed to the risks. So it was really sort of kind of making sure that there are robust processes to prevent those harms happening to women, making sure that there are safe processes in place before women are, sort of exposed to valproate during pregnancies and are informed and empowered to make those decisions before being prescribed valproate.
You've described a lot of measures there, but what are you doing? How have these measures been implemented in your trust or your practice?
So within our organisation, we participate within a national PharmacyUpdateOnline UK audit, which is a prescribing observatory for mental health audit led by the Royal College of Psychiatrists, and that helps to benchmark our practice nationally. We also have a valproate register, which we have developed a real-time report using data analytics tool called Tableau, which allows us to monitor our practice and compliance against the pregnancy prevention programme requirements. And more recently, we've also sort of implemented an exciting initiative, which I'm going to hand over to Anshu for, and she'll go through that with you as well. But it's a really sort of exciting co-production project, which Anshu will go through in much more detail.